Some of us are anxious to hear, what Harrington's been doing and just to update the community as to where things are, all
Sure,
things COVID related.
sure. Let me do that. I think many of you know our surge that we just had on the inpatient side has really come down. We have a half a dozen patients or so in the hospital. That's good news. We peaked about mid-January of 24. So we went through a big surge this time around compared to the first time. It was only maxed out at 12 on the inpatient side. I think we, as you all also know, we got into testing really early and still have two testing sites, one on South Street and one in Webster primarily. And those are still warranted to keep open, especially because of travel and other reasons. So we continue to do testing. I think we've done over 48,000 tests since the beginning. So that's pretty robust numbers there. I think the big issue for everyone right now is vaccinations. And, I'll answer any questions. I'll tell you what we're doing. The bottom line is I think, as you may know, or if not, I'll fill in the blanks. We got originally Pfizer vaccine and got more than enough to fulfill the needs for our employees initially without having to prioritize, as well as first responders, police, fire, EMS in all the towns we serve. So we did that in the first month, basically from December 16th. And with the second dose, it went on, but through probably early February, we were well done with that. That's when because we were doing it offsite at the community center, that's when we made a conscious decision and applied and negotiated with the state to become a regional and a statewide site. So with that, it allowed us to continue to get supply. For a while there, we actually received more supply either than we can use or even supply that we didn't even ask for. It was a little bizarre for a few weeks there where one day we got 4,000 doses and we hadn't even asked for it. We actually told them and they took us up on it to give it back to reallocate to others, because you don't want to be in a position where you're not getting the supply in the arms as soon as possible. So what we've done is we went from 150 a day. We made the conscious decision, knowing that we were statewide and the website for the state and then other efforts, to get up to 500 a day. And we are already there. We staffed for it Monday through Friday, 7 a.m. to 7 p.m. A normal day now is at least pretty much 500 schedule. Some may not show up because they found a closer place to go to. Although I will say probably 80 or more % now is locally based who's getting it. At the beginning, we had people coming from the Cape, from the Berkshires, from anywhere because they qualified under the criteria, and we had available slots earlier on. As we get more staff, we open up more slots, more appointments. We also ended up looking at, and how can we, and we are probably on March 20th or so, going to open up on the weekends. And we'll start a Saturday clinic, probably to start with 6 or 8 hours and then move to the following weekend, up to 8 hours both days. So I think that'll add another 300 to 400 easily each day of those weekends. So in no time, we should be in the 3,500 a week range, which is, I think, pretty remarkable for a small site relative and compared to, say, Gillette or Fenway. But as others open, we want to make sure we stay focused on the local communities. We've been able to do it with the use of the community center. We've been able to do it because the town and the police have been very helpful around parking and traffic control. We work together on a weekly basis with all the boards of health, including Andy and Southbridge and others, to really make sure that every one of those towns can help people, a lot of them through their senior center. I know in Southbridge through the Y, they are helping people sign up and get on the site and get the appointments. Sometimes it gets frustrating because appointments get filled up quick, and then, it depends how many more we can open when. We're trying to prioritize those in the local area. So bottom line is we had a little scare about 2 weeks ago because we had, well, let's put it this way. I was on a call. The real story is I was on a call with the Mass Hospital Association CEOs from throughout the state. And many of those hospitals had not, 90% of them, unlike us, did not offer themselves up as a statewide vaccination center. They were still doing their own employees or just their own patients. And the governor made a conscious decision, along with, shortly after, the local boards of health, to not supply those entities. This is about a week ago now. And he wanted to supply the larger centers because it's more efficient and you can get more doses out quicker if you supply them. And especially with the Pfizer, where you need to have ultra cold storage, and you open a vial, you want to make sure you use it, you don't waste it. So we were concerned, would we be thrown into the category with the other hospitals and get shut off, and all the appointments we had scheduled would have to be canceled, or were we treated differently? And with a lot of help from especially legislators and others, we got, there was a meeting held with Lieutenant Governor Polito, who, based on the whole discussion, committed further again, recommitted, I should say, that we would be treated just like Gillette. We would be provided supply to keep us going, which is critical, because we could get all the staff we want, but if we can't get supply, what good is it? And if those allocations got tight, because there was uncertainty how much they were getting from the feds, while local CVSs are getting it through a different program, we didn't want to be shut out because we already geared up. Why would I want to take it down? So we're continued. In fact, yesterday we got another 3,500 doses, which lasts us a good week, over a week. We'll probably get another shipment of 2,500 or so next week to keep us level. And as we get into the real weekends later in March, we'll just ask for more, and I'm sure we'll get it. You might have seen today, Johnson & Johnson got, I believe it was final FDA approval, or will. We're not sure how that's going to play out in terms of, I think it'll start rolling out next week, but we're not sure how they're going to determine who gets which vaccine. I suspect we'll keep getting Moderna, which is mostly what we've had. I'm sorry, mostly Pfizer, and we have a little of Moderna. We had about 800 Moderna and another 10,000 of Pfizer. So since we have the capability to take the Pfizer, we'll probably keep getting that. That's a quick summary, but I'm wondering, people have individual questions, anything I can answer? I think it's been a great partnership with all the towns, because every town would have had to fend for themselves if they wanted to do it. And it's different than a flu shot. It's just not it's not someone sticking the arm and you walk away. There's a much larger information registration process that involves going to the state with that data. There's a much more careful approach afterwards, that you have to wait 15 minutes or more, depending on if you have a reaction. And we've had a few people with reactions. 1 or 2 have gone to the ER, but they've been fine. But we have clinical people there to watch them in case there is any reaction. You don't want to have an event that's avoidable. Yes, Randall.
Hi, Ed.
Hi.
I'm a little confused about what the state has said about reallocating doses to the pharmacy chains.
Mhm.
And it seems to me that they are far less equipped to deal with this than with mass administration than places like Harrington. What do you think?
I agree 100%. The thing of it is this: the pharmacies really played 2 roles, and think of CVS and Walgreens, large pharmacies. And what the first role they played was in January with nursing homes. They went in with people to vaccinate in the nursing home, which is great. That part I agreed with. I thought it was good. I was more committed to doing our employees and first responders during that first month. And I'm glad somebody else picked up the need to vaccinate the elderly in nursing homes. The part now that's playing, and that was through, we got to be careful, because I don't believe it's the state that is responsible for the allocation so much towards the pharmacy chains as it is the federal pharmacy program, they call it FPP. So they go, the pharmacies are getting it direct from the feds, which is different and over and above the allocation the state gets directly and then gives to us. So the question really is, the feds are eating up some of that, if you will, supply to put in the hands of the pharmacies who, by definition, because we're not in a state where you could set up a drive-through with thousands of cars coming through a day or hundreds of cars. They're setting it up, as I've seen one, actually I saw it in another state, where they carve off about 50 square feet in their store, and they have chairs where 6 people can sit after they get a shot. They'll be lucky if they could do 20 or 30 a day. That's not very efficient.
Right.
So I think that's my understanding is that's a federal program that supported the pharmacies. Now, by the same token, our physician group, we also applied for doses. It's a separate corp, so we had to apply separately. We applied for supply for the physician group to eventually get to a point where we could do it in our larger offices, where we have enough waiting space, where we could administer the vaccine. We'd probably do it, not necessarily during a normal visit, we'd probably do it on a Saturday, say in our Southbridge office or a larger office in Charlton, where we could bring in some staff and get through some volume through that way. I think the key is, where can you get high throughput and get as many doses in people's arms as quick as possible? It's a very simple goal, but once again, if it's not as simple as a flu shot, you got to have the right pieces of the puzzle put together. And we've demonstrated, I think, in the Southbridge site, that we figured out, because we played around with the throughput while we were doing our employees. So we then could use it to do it for the community. And that was the whole goal. In fact, just as an aside, 2 things. About a month after we did it, I talked to my colleague up at Haywood, and the town was doing it very minimally, but doing it. And he had done it for his own employees, but he hadn't yet become a statewide site like we did. About 3 weeks ago, he became a statewide site, and now he's designated just like we are. So he liked the model. He sent people down, he looked at it. The other thing was, today, I believe I was told there was a press release going out from the Lieutenant Governor's office, and there was a press conference, I haven't seen the result of it, by the Lieutenant Governor around vaccinations and other things. And she was going to reference and comment on what we've done here, which I think is good recognition that we should get, because I think what we've done is, way ahead of a lot of communities and a lot of hospitals. So that's the story on that.
So as far as pushing the vaccine out to local physicians' offices, I think it's the Pfizer that has to be held in ultra cold storage.
Yes.
You have to administer that once it's removed from ultra cold storage.
I think you have 6 hours when you puncture the vial, and you have so much time. You could use dry ice for the interim period. You just can't store it for weeks at a time, obviously. Moderna is more appropriate for physician offices. It doesn't require that level of freezer.
Right.
Isn't the Johnson & Johnson going to be even less? That's a
the Johnson &
single
Johnson,
shot.
number 1.
Yeah.
Yeah, it's supposed to be 1 dose, number 1. They're talking about boosters or not. That's always the question, or the uncertainty of how long the vaccine is going to be effective for. So that's a real another question, because what if it only lasts 6 months? What if it lasts a year? We're still back at it. Is it going to be one shot or two shots in the future once they learn? And of course, what about the UK or the South African variant? And are these vaccines truly effective against those? And what if they continue to, become more mutated? So I think we're into all of those things, and then what's the effectiveness of Johnson & Johnson compared to the others? It didn't have as high a number, but it still prevented the mortalities from happening. So, and I'm not so sure that people will have a choice, meaning whatever vaccine we get is what I'm going to give out. And we, even Moderna or Pfizer, we didn't ask preferentially, which do you want? We just gave out as we got it. One difference, of course, is Moderna, you have to wait 4 weeks, supposedly, for your next one. Pfizer was 3 weeks. Not a big difference. And then the other part is it's hard to manage, and I say the folks at the vaccine center are working hard. It's hard to manage people who get on the schedule who may not meet the criteria. You can, I'm sure, creatively get through the system and maybe not fully meet the criteria. And given the governor did open up a week ago, 65 and over, and 2 comorbid conditions, it's really hard to police that. And we have people I know sometimes waiting online out the doors, and the feedback in general though has been very good. And I think I'm pleased that we can offer it, because without it, I think it would be a real nightmare trying to push. If you think about it, we like to think we serve 16 or 18 communities, probably total population 175,000. If 3/4 of that is eligible based on age, ultimately, it's well over 100,000 people at 2 shots apiece, or 1 shot if it's Johnson. So either way, if you're pushing out 10,000 a month, that's still a long time to get it out there. Hopefully we can continue to escalate that, or people will go elsewhere to find it. But that's an undertaking. That's a long-term undertaking. It's not just for a couple of months. It's really like we're in the business of doing vaccines for a while. Now, the good news is when we made the decision to do it, we bill insurance companies, but we know that Far Out is underpaying us for the cost that we were incurring. The good news is we found out a month ago, after we were committed anyway, that federal government through FEMA will reimburse us for losses associated with vaccination. And FEMA will also provide some relief for the towns. And obviously, if the 1.9 trillion passes, there's some money in there for towns as well. So we'll have to see how all that shakes out.
Well, I've been up to the vaccination center in Southbridge a few times, and I'd like to give you the feedback that everybody is so impressed with how well it's working.
Well, thank you. And what I always like to say is, in our business, we deal with people who are going through difficult times a lot. And, it's very rewarding in the vaccine center to see that on both sides of it. The people who are administering the vaccines are very proud and happy to be there. You almost could see the smile through both masks, meaning the caregiver is giving it and know they're making a difference to people who want to come in and really want it. And you could see the relief on people's faces who get it. They're just so happy to have reached that moment where they say, at least I feel there's a beginning to this sense of protection and ultimately someday normalcy, right? And I think us being a part of that experience, I feel fortunate that makes me really proud and happy that we could be in the middle of it all. And I get emails and letters and feedback that I share with the board and everything that is remarkable, because it's, and it's something that I like to believe we had a choice. We didn't have to do it, but we chose to do it. We had to do our own employees to protect our employees so we could care for patients. but we didn't have to put ourselves out there to take on hiring another 20 or more people, managing it, gearing up. I mean, honestly, it's probably just, if you think of it this way, it's one more headache, right? in running a healthcare system. On the other hand, it's our mission. It's our job. It's our job and our desire and our, for me, it's the pride of saying, wait a minute, our mission is to make this community as safe and healthy as possible. And I always say that this way, if not us, who's going to step up and do it on a broader scale? And there's no Gillette in Central Mass. If you haven't noticed, there's no, even Worcester State, they might get up to 2,000 a day. We'll be up to 750 probably within a month, let's say. And the anxiety out there is all about how quickly can I get the shot? So it's up to us to really drive that. And that's what we've been doing. And I'm pleased because, like I said earlier on, most hospitals didn't jump into it that way because, for good reason, they had lots of other things going on, but so did we. And we just said, we're gonna jump on it because I recognized how important it was to the people who live and work here. And I'm hopeful that we'll get through this. Hopefully, maybe there'll be some sense of getting back to basics, normalcy, as we say, in the summer, if a large percent are vaccinated. One thing that could be helpful, and I worry about this, even with our employees, initially only 65 or 70% said they want the vaccine. And a few more are coming forward now because they saw people didn't die, they didn't get that sick after the second shot. Some were just waiting and seeing. But if we don't get to the 80 or 90% of people willing to take the vaccine as the supply and eligibility becomes available, then we're still going to have the virus lingering more and more and be transmitted. So how do we all together educate people to get them on board with being willing to get the shot? Because if they don't, it's not helping the greater good. And for me, it's about getting this virus, at least for this year, not to have another surge, to get it by us, and then see what the results are for the following year, and hope that it has some lasting power, that it'll not be, effective after 3 or 6 months, God forbid. That would be a nightmare. So I think we need to, encourage everyone as best as possible when they're eligible to get it. Other questions you guys might have, because I really am happy. Yes, Peter.
Yeah, hi Ed.
Hi, Pete.
Big Bunny, as you probably know. I was just wondering, when we get to the point where our employees are eligible for the shot, is there a way that we can group them in some way, that we can register them internally or help them register and get them lined up? Because, frankly, if we leave it to them individually, some will do it, some won't. Some will give up easily, even if they try. So I'm thinking, if there's some way that, we as a company can group them and present them for the vaccination.
Yeah, I mean, you could assist them in registering, but we've not chosen yet to say we'll do groups of people either in block or off-site yet. We are thinking about reaching out within the community, and maybe this will help in a mobile way. Can we take the van that we have, put it in front of your store? Could we put it in a more strategic site in the middle of the Latino community, perhaps, and get people vaccinated that way? It still would require registration, and it's a little more difficult logistically, as you could imagine. But, if they're having trouble, or if they're eligible, or when they're eligible, and they have trouble signing in, then I think the Y made an effort, the senior center is making an effort to help people get online and get an appointment. Yes, Chris?
Hi, Ed, I'm Chris, and I'm the new executive director of the Y. I've been there a couple of years.
There
So
you go.
I was just going to speak right out and say, Pete, send them over to us,
Right.
give it a call. We are so quick and efficient now, and I can do this in my sleep and register people. I'm
And
not,
that's a huge service because at the beginning, especially with the over 75, they either didn't have the right computer or they couldn't understand or they couldn't get online, understandably. So they need that support system to walk them through it or do it for them. And, the Y or others in other towns are making that effort. And I think that's the link, that's the bridge that we needed. So thank you for doing that.
Thank you.
Do they
Denise,
have to go in person with you, Chris, or is it a phone call to
Nope.
register?
you can do either or with us.
Well, the reason I say that is, Pete, you could offer up during their break time or something. Here's the phone line. She knows Pete, you could set it up where there's a time when big money people, certain shifts, are going to contact you, and that would give you that feeling, Pete, of the company-wide push to get your
Right.
people,
Right.
inoculated. Maybe something like that. Do a little plan where she facilitates it, even if it is by phone, but it's on,
All we
something.
have to do is serve pizza and they'll come.
Right. And make a phone call to get your slice of pizza.
that
what
works.
I was going to say, Pete, some of my employer groups, on the employee benefit side, they've asked me a lot of questions and they've been actually incentivizing. I have one company that says, if you go and get it, you'll get an extra vacation day, or, you'll get a half a day of work. So, or like you said, the pizza, but that's what I'm seeing on my end is the employers are giving them incentives to go and get it and, hang the fish in front of them or whatever, just to get them to go.
That's great. No, I think it's a matter of now rallying the rest of the community as they're eligible, because we're going to be inundated for months. And I, just be patient, tell people to sign up when they should. They'll get an appointment, but be patient, because I think it's just, and like I say, we're now able to hire people, not only rely on volunteers. And as we do, we'll get more steady people working there regularly, and I think can grow beyond even 500-600 per day. So, and I think the town's been great. We have a weekly call, by the way, with a dozen people everywhere between Chief Normandin, Chief Woodson, Mike McCall, you name it. They're all Andy. They're all on the call. La Rochelle, Roland. I mean, a lot of people involved in making sure the operational aspects continue to work well, from opening and closing, cleaning, etc. And then, I've got security there. I've got, a whole bunch of nursing folks there. We're using, by the way, Quinsigamond Community College students, which have been really good. Medical Reserve Corps. I mean, we've pulled out all stops to try to get, and especially initially, volunteer and otherwise, and the other towns as well. I know Southbridge, Charlton, a bunch of them, the boards of health in those areas, they've been every week in really good communication with us and doing the same thing to try to get people to come. They wanted to, some of those towns were on the verge of setting up their own, what I'll call pop-up clinics for the day, until the state shut them off with vaccine, and they were super disappointed. But at least we continued, and if we were shut down, then it would be a disaster for the whole region. So I'm so pleased that our legislators, and if you see them, thank them, Peter and Senator Fatman and Goby and McKenna, they all rallied round for us. And I would say we stirred the pot pretty well and got a good response. And I don't mind doing that ever, that, because I think we have to stand up for getting what we need, and having established a model that should be emulated, not shut down. I was a little ticked off when they potentially would have cut us back to zero. So we prevailed, and I think we're continuing on. So all good stuff.
I got my
Yes.
shot just last night, as a matter of fact. And my appointment was at 5:45, and I was home at 6:25.
Wow. That's perfect.
Yeah.
Yeah. Was it
Very
busy?
well
at all? It slows down then usually. Was it busy?
Well, there wasn't a line out the door, but it was steady. There were people at every booth getting processed, and there were people sitting waiting to be taken, and
Good.
but it went very well.
Well,
It's a
that's
smooth
what
running
we,
machine.
what's that?
It's a smooth running machine.
Well, that's what we hope to hear all the time. But, I know sometimes, like with the snow days, my God, that was a disaster. Could have been a disaster. But we actually squeezed people in and shut down like half a day or less, but still got almost the whole day in just because they went crazy trying to do it quickly and it worked. So, fortunately, there's no major storms in the forecast, and hopefully that'll be behind us in another few weeks or month. But yeah, no, we're rolling along, and stay tuned. If there's anything else, we'll keep you guys posted. And thanks for asking me to join you for tonight. I appreciate it.
I do have one question.
Sure.
If you work in Mass, but you reside in Connecticut, you're still able to go through Mass?
I believe we wouldn't I don't think we turn you away. Well, let me put it this way. I have a lot of employees that live in Connecticut, and I know we vaccinated them. So I would think that would be the case. I wouldn't turn anyone away that way. You still have to be identified in the system as to what town you're in for reporting purposes, but it gets a little tricky. I mean, I'm sure it's done because, like I say, I'm sure I have a lot of people in Woodstock and elsewhere that we vaccinated. It's just a matter of where the data goes.
Right.
But I'm pretty certain it's probably okay. I thought a bigger question was, I thought of this question. I know people who used to live here, or maybe it's kind of, what if you live in Canada? Would you think we're allowed to vaccinate someone coming down from Canada? Maybe they have a residence in both places, or maybe they used to work here. That's an interesting question. I'm not sure the answer to. I got to find that out. But yeah, Connecticut, definitely. We have plenty of employees, I'm sure, as you might know of, that work in Massachusetts. We should vaccinate them.
Right.
So I have no problem with that.
Okay, thank you.
Sure. Otherwise, anything else for me?
Yeah, Ed, could you tell us just a little bit how the hospital itself is handling things? I mean,
Oh, sure.
Obviously the surge is gone, all that, but I mean, how is the hospital economically doing? This is business partnership. You are a business here in our community.
Sure,
You are
sure.
a lawyer.
Well, two things. Thank you, Denise. Two things. We are holding up. I would say the challenges are a bit greater because there's still some portion of the population that has not chosen to get their routine medical treatments, which means less volume and less revenue for us. And it's very apparent in the ER that the ER volume is about 20% off, which is no different than most hospitals throughout the state, which doesn't make me feel much better because that's revenue we're not seeing. And that's both ERs. So on a typical day in Southbridge, we used to see 70 patients a day. We now might see 55 or 60. And ER, with the generation of other tests, generates a lot of revenue. We closed urgent care in Charlton, so that's a loss because it wasn't volume enough at the time to justify it. Oxford urgent care is open, but in general, certain volumes have been soft. We've had, through the first 4 months of this year, we're off target by a couple of million, but we're not in rough shape because the federal government did give us money for last year's losses to some degree. So we're okay there. Now, the next question ought to be, and I'll just say it because I think it is a good question. So where's all that lead to relative to where we are with the UMass Memorial acquisition?
Are you all aware of that?
And
I'm just curious because maybe people don't even know.
finding
Just saying.
Oh,
or being acquired,
Lost him.
if you live under, if you hear the news somewhere along the way. So yes, thank you.
Uh-oh.
uh-oh.
We
Ed,
are
we lost
under
you.
regulatory review right now. You lost me?
There you
Yeah,
go.
Can you hear me now?
Yeah, can
Am I
you
back in?
rewind 30 seconds?
Back to
Okay. Can you hear me?
Now we can.
Is it okay?
Yeah.
Okay. So the, am I good? Good?
Yeah, rewind
Yeah.
30 seconds.
Okay. All right. So bottom line is UMass will acquire us likely by around July 1st. And then we're part of their system. They understand our financial situation. We still are moving ahead with major projects. We're finishing up the ER here. We just received a CAT scanner to go in the ER itself as a second CAT scanner in Southbridge. We're
Great.
taking our psych unit from Southbridge, expanding it and moving it to Webster. So we'll have 40 psych beds between 2 units over in Webster, probably by October. And things are moving along very nicely with that. So that's the update there.
Thank you.
Bye-bye.
Thank you.